Good morning, everyone. This is Massachusetts Governor Charlie Baker. I want to thank you for this opportunity to address the Health Policy Commission's 2021 cost trends hearing. Again, and I want to say thank you to David Seltz and the team at the Health Policy Commission for your tireless efforts to assess and improve our healthcare system so it can best serve the Commonwealth's families and our communities. And I also hope at some point we get to do this again in person. I do want to thank the board, which I obviously can't see, although I know many of you, and I especially want to thank Dr. Stuart Altman for his work as chair. The past 18 months have reinforced the importance of the Health Policy Commission along with its critical mission, and we're grateful to everyone who's involved with this organization. There's a lot that's changed since last year. A year ago, we were in the middle of the battle with the COVID-19 pandemic, and Massachusetts made important progress to keep the virus in check throughout the spring and summer of 2020. But as the public health experts predicted, we confronted a surge of cases in the fall and winter that tested our healthcare system. Fortunately, the healthcare community stepped up to the plate like they always do, and our healthcare system made significant strides in its ability to treat patients. And by the end of 2020, we were able to launch our program to distribute life-saving vaccines to protect our residents and our communities. We started with the healthcare workers, residents of long-term care facilities, and people in congregate settings like group homes and treatment facilities. We then focused on vaccinating older adults, those in the frontline fields, and those with underlying medical conditions. And by the end of the spring, vaccines were widely available, and today, Massachusetts has led the nation in vaccination rates on a per capita basis for months. Over 90% of all adults have had at least one dose of the COVID vaccine, and among adults over the age of 65, that figure's now over 99%. And our vaccination rates among kids are about 15 to 20 percentage points higher than the national average, and they also continue to climb. Recognizing the disproportionate impact of the pandemic on communities of color, we also focused relentlessly on increasing access and awareness in the 20 hardest hit communities through our equity initiative. This $30 million effort focused on building trust in the vaccine and making it as easy as possible to get vaccinated, to support the folks in the communities that bore the brunt of the virus. Today, we're proud of the progress we've made. Many of these 20 hardest hit communities actually have higher vaccination rates than the state does overall. For example, in Chelsea, which for many months was at the epicenter of the pandemic in Massachusetts, over 99% of eligible residents have received at least one dose of the vaccine. We continue to vaccinate more residents every day, and in the past several weeks, we started to distribute booster shots to eligible populations as well. But as we continue to protect our residents from COVID, it's also important to reflect on the ways the pandemic has changed our healthcare system. The virus challenged us like never before, but it also prompted us to make important changes that will increase access to quality, affordable care. On January 1st of this year, I signed a comprehensive healthcare reform law, and it included several provisions our administration included back in October 2019 when we filed our original healthcare reform bill. And it also codified into law several measures we put into place to support the healthcare system and the people of Massachusetts at the beginning of the pandemic. For example, in March of 2020, I signed an executive order requiring insurers to immediately cover telehealth to ensure the continuity of services remotely when it wasn't safe to do so in person. This led to a rapid shift to remote delivery and significant uptake in telehealth services. For example, from March of 2020 through June of 2021, MassHealth received over 15 million telehealth claims. That's a big number, and it speaks to the power of telehealth as a tool to connect more people with the care that they need. It also reduces the potential for missed visits. According to survey data compiled by Commonwealth Medicine at UMass Chan School of Medicine, healthcare providers that utilize telehealth services reported a 25% reduction in no-show rates and a 36% reduction in wait times. And so as we worked with our legislative colleagues on a comprehensive healthcare bill last year, the evidence became clear that this expansion was working. And it was critical for us to find a way to establish a framework for telehealth to become a permanent part of our healthcare landscape here in Massachusetts. The law I signed earlier this year requires coverage parity for telehealth services and implements permanent telehealth rate parity for behavioral health services. In addition, it requires rate parity for telehealth coverage for primary care and chronic disease management services for the next 2 years. We also codified changes we made on an emergency basis to expand our healthcare workforce's capacity. At the onset of the pandemic, I issued emergency orders expanding the scope of practice for several types of practitioners and streamlined licensure requirements before independent practice. The law I signed in January makes several of these measures permanent, expanding scope of practice for nurse practitioners, nurse anesthetists, mental health specialists, and optometrists. The law also includes steps to protect consumers from surprise billing, including a provision that requires providers to notify patients in advance as to whether a procedure is in or out of network. We're grateful to work with our colleagues in the legislature and many other stakeholders attending today's hearing to get this comprehensive law enacted. But our work's not done. COVID underscored that our healthcare system still needs meaningful reforms in several key areas. In particular, our administration remains committed to the goal of incentivizing primary care and supporting behavioral health within the context of the overall healthcare cost benchmarks. We understood the importance of investing in these areas before the pandemic when we filed a bill in 2019 that aimed to boost spending in these areas. But the pandemic, both its presence and the impact of it, drove home the need to invest in these areas, especially in behavioral health. While telehealth dramatically expanded people's access to behavioral health services, we know there's a lot more work to do to promote behavioral health parity and to get residents access to the treatment they need. We remain committed to the provisions we filed in our initial healthcare reform bill, which incentivize payers and providers to focus more on these services. In the coming months, we'll have more to say about our healthcare reform priorities so we can continue to address key challenges like access to behavioral health services, which, as we all know, for both adults and kids coming out of this pandemic, is something we need to put significant effort into if we plan to serve all the folks who are looking for access to behavioral health services coming out of this very difficult time. And as part of that process, we look forward to continued conversations with the folks at the Health Policy Commission and many other partners who are attending today's hearing. Along the way, we'll keep in mind the Health Policy Commission's mission to provide better health and better care at a lower cost. That's a mission we all share, and we're grateful for everything you're doing today to advance that goal. Let me just close by saying once again that one of the most important things we need to do is start thinking a lot harder about some of the services that keep people healthy and not simply focusing on the ones which are critically important that are there for people if they happen to get sick. That is why we think these investments in addiction services, behavioral health services, primary care, and services to seniors are so important as we move forward. I want to thank you all again, and I hope you enjoy the rest of the hearing, and we look forward to having a chance to digest and build a reform proposal based on the contents. Thank you.